everyone, and welcome back to the Wellness Odyssey Peer Podcast. Today, we're diving deep into a topic that affects millions of women, yet is still so often misunderstood. We're talking about PCOS, PCOD, and PCO. If you've ever felt like something's just off in your body, or if you've struggled with mysterious symptoms like irregular periods, weight gain, acne, or hair loss, there's a chance you might be dealing with Polycystic Ovary Syndrome. It's not just about cysts on your ovaries. There's a lot more to it than that. Let's break it down today.
Absolutely. It's something that affects around 1 in 10 women, but most women don't even realize they have it until they've been dealing with these symptoms for a while. And like you said, the term PCOS gets thrown around, but what does it really mean? We hear PCO, PCOD, and PCOS all the time, but what's the actual difference?
Great question. So, PCO stands for polycystic ovaries, and that just means you have multiple small follicles on your ovaries, which are fluid-filled sacs that contain immature eggs. But here's the catch. Just because you have polycystic ovaries doesn't mean you have PCOS. Many women with PCO don't even experience any symptoms.
Right, so just having cysts on your ovaries doesn't automatically mean you have PCOS. And then we have PCOD, which is an older term, right? What's the deal with that one?
Exactly. PCOD, or polycystic ovarian disease, was used more in the past, but it's not the most accurate term anymore. PCOD refers to when those cysts start causing hormonal imbalances and other symptoms. Now, PCOS is the term we use more often because it's a broader, more accurate way to describe the hormonal imbalance that actually causes the symptoms, like weight gain, acne, and more.
So PCOS is the syndrome that ties everything together. It's all about hormonal imbalances, right? But when we think of PCOS, what are some of the most common signs women should be looking out for?
Well, the first red flag is usually irregular periods, whether that's absent periods, really heavy ones, or ones that come far too infrequently. Another big sign is difficulty losing weight, especially around the midsection, no matter how hard you try with diet and exercise. Acne is another huge one, particularly cystic acne around the jawline and chin, and hirsutism, which is excessive hair growth on the face, chest, or back.
And let's not forget the hair thinning or loss on the scalp, kind of like male pattern baldness. It's also worth noting the mental side effects like fatigue, mood swings, anxiety, and even depression, right?
Absolutely. And insulin resistance is a key factor for many women with PCOS. Essentially, your body struggles to use insulin effectively, which can lead to higher blood sugar and trigger other symptoms like weight gain and fatigue.
It's crazy how many women are told these symptoms are just normal hormonal fluctuations. But the truth is, PCOS, if left unmanaged, can increase your risk of things like type 2 diabetes, heart disease, and even certain cancers. It's so important to get the right diagnosis and management.
Exactly. That's why awareness is crucial. The good news, though, is that while there's no cure for PCOS, it is very manageable with the right approach. It's not all about medication either. Lifestyle changes can make a huge difference.
Right, like focusing on nutrition, eating whole, unprocessed foods, and balancing blood sugar. Movement is another huge one. Regular exercise, especially strength training mixed with cardio, can really help.
Yes, and don't forget stress management. Stress can seriously throw off your hormones, so finding ways to de-stress is essential. And of course, sleep is huge too. It's critical for hormone regulation.
Absolutely. And for any woman out there experiencing these symptoms, don't try to self-diagnose. Talk to your doctor, advocate for yourself, ask for hormone level tests, blood sugar tests, and maybe even an ultrasound. Getting a proper diagnosis is step 1.
Spot on. And just know you're not alone in this journey. Getting the right diagnosis and treatment can make all the difference.
100%. And that's all for today's episode. We hope this has helped clarify some of the confusion around PCOS. Next time, we'll dive into T's next topic.
Until then, take care of yourself. Stay healthy, stay informed, and always listen to your body.
Thanks for watching. Like, share, and subscribe for your better health always.